Hello and welcome to Epilepsy Ireland HQ. I'm Paddy McGeoghegan and I'm Epilepsy Ireland's Advocacy and Communications Manager. We're here today to talk to Dr Yvonne Langan about a very important new study which concerns sudden unexpected death in epilepsy, or SUDEP as it is more commonly known. The study has been made possible thanks to support from Epilepsy Ireland, the Health Research Board and Jazz Pharma, and is the first of its kind study in Ireland as it confirms the incidence of SUDEP in our country. We know at Epilepsy Ireland that SUDEP can be a difficult topic to talk about, but having open conversations like this helps raise awareness of SUDEP, the known risks, and crucially, what can potentially be done to reduce them. So if you're living with epilepsy, supporting someone living with the condition, or simply want to learn more, this conversation is for you. So with that, I'd like to formally welcome Dr Yvonne Langan to Epilepsy Ireland HQ. And to begin, Yvonne, can you tell me a bit more about you, your roles, plural, and your career to date?
Thanks, Paddy. Well, I'm a dub. I'm a graduate of Trinity College, and I started my neurology training many years ago, first of all in Dublin. And after that, I got the opportunity to go to the Institute of Neurology in London and do some research into SUDEP. I then became an honorary Geordie and went up to Newcastle upon Tyne, where I finished my neurology training. And then because of my interest in epilepsy, I decided to train in clinical neurophysiology. So I'm very involved in all the brainwave tests and EEGs that people with epilepsy might have. And after 11 years in the UK, I came back home to Dublin, to St James's Hospital as a consultant in clinical neurophysiology, where I've been for the last 16 years and continued to have an interest in SUDEP and to try and undertake as much research into SUDEP as possible, always with the support of Epilepsy Ireland.
Great. I suppose that leads me to my next question. Can you briefly explain SUDEP and why it's important for people to know about it?
Well, I first encountered a case of SUDEP over 30 years ago when I was a neurology registrar in Dublin. And it was a case of a young man who was found dead in bed at home with a little toddler beside him. And I mean, the details of that case have remained seared on my brain. It's not something I had encountered before, and that is what sparked off my interest in the whole subject. And following that, we undertook a project to look at the frequency of SUDEP in a very limited geographical area in Ireland, in South Dublin and Wicklow, and with the help of the coroners and the pathologists in St Columkills and St Vincent's, we were able to look at the incidence of SUDEP in that small population. And I mean, it's a scary subject, and the intention is not to frighten people, but we do know that those with epilepsy have an increased risk of sudden death. So it's important that we're aware of it so that we can take steps to reduce risk. And I mean, it is really what it says on the tin. These deaths are sudden, unexpected, typically occur at night, during sleep. There's often evidence that the person involved might have had a recent seizure. We don't know what causes it. I mean, naturally, you can imagine that the thoughts that investigators have had over the years. Is it a malfunction in the heart? Is it a problem with breathing? Is it a problem with brain? They're looking at chemicals in the brain called neurotransmitters that might be involved. And following a big study looking at individuals in epilepsy monitoring units worldwide, one of the latest theories is that following a seizure, it's a kind of a brain malfunction that feeds into heart function and breathing function and causes those to fail.
And I suppose with that explanation, leading into your own research, why was this study undertaken and why is it so significant for us here in Ireland?
Well, as I mentioned, the only figures we have for Ireland are just from that very small geographical area, and they're 30 years old. Now, there are figures for the frequency of SUDEP in, population in the UK and in the States and in other places, but we shouldn't assume that those figures should automatically translate to Ireland. I mean, because we know that the risk of SUDEP may be related to seizure control, and obviously access to health services and differences in health systems may influence that seizure control, it's important that we have our own figures for Ireland. And also, if we're going to try and do things about it, about the risk, about reducing the number of deaths from SUDEP, we have to have a figure that we can start with and that we can monitor over time. And also, as you know, if we're going to go to the powers that be and look for resources and look for an improvement in systems, we have to be able to say this is the situation that we're dealing with.
That leads me on perfectly to my next question, I suppose, to go into the key data. What were the figures for Ireland and what is the incidence study, or incidence figures?
We know that, or we assume that because of the coroner system that we have in Ireland, that most of these sudden deaths will be referred to the coroner and undergo a post-mortem. And we know from previous work with the Health Research Board that they have a very good system in place for examining deaths that are referred to the coroner. So we were lucky enough with your support to be able to piggyback onto that system. So for the year 2019, all deaths that were referred to the coroner were examined, not just those where epilepsy might have been mentioned on the death certificate. And the research nurses in the Health Research Board, then if they felt there's probably a history of epilepsy here, they passed those details on to me, and I was able to look at the details and decide then whether I thought this was a case of SUDEP or not. Now, I was very particular about deaths that I classified as SUDEP, so our figures may actually even be an underestimate of the number of deaths. And we know how many people in Ireland have epilepsy because we know the prevalence of epilepsy in Ireland, so we were able to work out an incidence rate or a rate of SUDEP in Ireland for that year. Now, we identified 33 deaths, 21 men and 12 women, a wide age range from childhood up to the very elderly, but you know, the commonest age range was in the mid-40s. And one thing that was quite notable actually was that in less than 50% of cases, SUDEP was mentioned on the death certificate as the cause of death. So just counting death certificates would not have given us a reliable figure. So we know, we've calculated that our incidence of SUDEP is about 1 per 1,400 per year. So for everybody with epilepsy, we might anticipate that 1 in every 1,400 per year would succumb to SUDEP.
So, Yvonne, can you tell me how, if you can, how our figures, our incidence rates compare to maybe other jurisdictions in other countries from the data you've seen?
It's very similar to what's been identified in the UK and the US. It not any different really from their figures, and indeed our most at-risk age group is similar to other studies as well, really from the young to the middle-aged, and the extremes of age appear to be less at risk.
And can I ask, you mentioned about the wide age range in terms of the data you have found. Is there any other patterns that popped out to you, or anything that you'd like to zone in on? I
suppose it's slightly more common in men, and I mean that's what we expected based on the work of other researchers. We know it appears to be a phenomenon that seems to take people in their prime, really at their most productive, although it is possible that it's under-recognised in the elderly because of the way the definition of SUDEP works. And I suppose the other point that I've already mentioned, but which I think is important and is something that we can work on, is the kind of documentation really, and the way these deaths are certified. Not only was SUDEP often not mentioned, but sometimes epilepsy wasn't mentioned as well. So there's something to work on there.
Yvonne, we talk a lot about risk factors when it comes to SUDEP. Can you speak more to the known risk factors, and are these potentially preventable or manageable?
Paddy, we know from research that's been undertaken that the most significant risk factor for SUDEP is poorly controlled seizures where a convulsion happens. And we also have some evidence that convulsions that occur at night may have increased risk. And obviously there's things then that can impact on seizure control, like poor adherence to anti-seizure medication or lifestyle factors that can provoke seizures that might be important. There's also some evidence that supervision at night might have a protective factor.
But obviously you've spoken about the part of the research that has now been published in specific relation to SUDEP, but there's also a second part of the research. Can you explain that to everyone watching and what exactly that's investigating?
Well, we know that there's a category of deaths associated with epilepsy called epilepsy-related deaths that happen because of the occurrence of seizures. Now, the commonest category of epilepsy-related death is SUDEP, which we've been talking about. But there are other causes of death that are related to seizures, and I think it's important that they're not forgotten, that they're not swept under the carpet, because they also may be amenable to prevention. So I'm talking about things like accidents, like drowning, like uncontrolled seizures, something we call status epilepticus. So as well as identifying and picking out cases of SUDEP from the data in 2019, I'm also going on now to look at other causes of epilepsy-related death. And just, roughly it looks like we'll identify an additional 50 deaths in that year due to, as I mentioned, drowning, but also due to things like aspiration and accidents and causes like that. So that, data is to come, but it's work that's ongoing.
So we're potentially looking at 83 lives lost during the reference.
Yes, yeah.
Okay. Which is obviously devastating for anyone
Absolutely.
who's left behind. So I'm going to move on more about the awareness of SUDEP, and I suppose it's a double-barreled question. Do you feel we as a community, both people with epilepsy, their families, and then also healthcare professionals, are fully aware of SUDEP and know about the importance of being aware of SUDEP?
Well, I think awareness is all important, even if it is a scary subject. And when I talk to researchers in our own little sort of SUDEP bubble, it seems that everyone knows about it. But, I don't think that is the case on the ground. I think there's naturally enough a reluctance to talk about what is a difficult subject. And at the time of a diagnosis of epilepsy, obviously it can be a great shock. There's a lot of information being shared, can have a lot of impact on day-to-day life. So it's a subject that, it's difficult to approach. And also we know that when we're talking to people about difficult subjects, even if we say things, it's not always taken in. So that, the communication aspect is very important. And I mean, we do know from research that despite guidelines and advice, that a lot of clinicians are reluctant to talk about it. And I think there's a lot of room for improvement there. Indeed, the Epilepsy Research Institute in the UK recently had a SUDEP workshop, and to kind of define research priorities, and actually research around communication was a top priority for the group. Okay.
And how do you see us using this data to, I suppose, move the dial forward in terms of increasing awareness and I suppose, stimulating conversations in our community about SUDEP?
Well, I think the fact that we have, Ireland-specific figures now allows us to kind of centre a discussion, to say it is an issue here. We can't, ignore it, even though we always knew it was happening. But, we can say we have proof now that it happens in Ireland. So because we think these deaths, or at least some of them, are potentially preventable, we have to think about what we can do about it. And I suppose one thing is about optimising access to healthcare of the highest quality, and making sure that everyone gets the same access across the board in a timely manner at the time of diagnosis, given the right advice, given the most appropriate treatment. And then obviously for the cohort of people with epilepsy who might have epilepsy that's particularly difficult to control, making sure that they get access to the most up-to-date treatments.
Yvonne, in your experience, how aware do you feel people with epilepsy are of SUDEP?
I think, Paddy, that people with epilepsy and their families are not sufficiently aware of SUDEP. My experience in dealing with bereaved families in research in the UK, I mean, the vast majority were not aware of SUDEP prior to its coming and robbing them of their loved one. We know that there is a reluctance amongst clinicians out there to discuss SUDEP. And we also know that even if it is discussed, you know, it's a scary subject that might come at a time when there's a lot of discussion ongoing. So there may be a need for reinforcement and for it to be discussed on a number of occasions.
Yvonne, can I ask, in your clinical experience in terms of actually counselling a patient or their family member about SUDEP, what has the response been like from the patient?
I mean, I think it's a difficult subject. It's difficult for them to hear about it, for people with epilepsy and their families. It's difficult for people to talk about it. And I think it has to be, it's easiest to kind of ground it in an overall conversation about the risks associated with epilepsy in general. And to go back to that point of individuals not retaining information, you know, that's given in a stressful moment. I do often think if I went back and asked again after a session how much information would be retained. So it brings us back to the point of continuous need for reinforcement and for knowledge about SUDEP to just become more mainstream and out there. So when you think, Paddy, that, you know, new mums are told about the risk of sudden infant death and about things they can do to reduce the risk for their baby of SIDS, you know, and there are other medical conditions out there as well where there's a risk of sudden death and patients are told about it. So I think it's important that you know, we keep working on the communication, really.
Yvonne, just for a moment, I'd like to particularly focus in on young people living with epilepsy and the families that support them. Is there any advice that you would give to their parents or their families on how to broach the subject of SUDEP with the young teen or young person living with epilepsy?
Well, Paddy, I mean, in the ideal world, SUDEP would be a subject that has been talked about from, you know, the earliest time when epilepsy has been diagnosed, so that it doesn't have to come as, you know, a shock at some stage. That being said, you know, a parent's job is to become redundant, and I think it's very important that people with epilepsy realise that they have control, and that the days of, you know, patriarchal medicine and people telling you what to do are on the way out, and you know, forewarned is forearmed. So I think that we have to aim to let young people know that there are risks to epilepsy, not just from sudden death. I mean, people can more readily maybe understand the risk of accidents occurring with seizures. So sometimes I use that maybe as a starting point in discussions and work up from there. But you know, I think one aim, and we haven't mentioned one aim when we're managing people with epilepsy, is that they have as independent a life as possible. So I know we have to thread that difficult line between, you know, parents being very protective and teenagers wanting to strike out and have an independent life. So I think it's very important that they're involved in the discussions. They know that there are things that they can do to modify their risk of SUDEP. And while I think what we want to avoid maybe is, you know, a crunch time where there suddenly has to be a discussion about SUDEP, but I think it does need to be out there in the mix and people need to be aware of it.
So Yvonne, how can people with epilepsy potentially reduce the risk of SUDEP?
I think, Paddy, based on the evidence that we have, we're looking at optimising seizure control firstly. So that may vary from individual to individual, and I would encourage people with epilepsy and their families to touch base with their treating clinician about how they can for themselves reduce the risk. So it may mean reducing the number of convulsive seizures by changing lifestyle factors, by access to the most appropriate anti-seizure medication, and in a certain proportion of individuals with epilepsy looking at other treatments like epilepsy surgery and more, I suppose, more advanced therapies like that. And then also we might look at the protective factors. We don't have any, I suppose, it's not that they've been trialled in studies, so with regard to the alarms we can't say there's definite evidence, but there is increasing interest in the use of alarms as potentially reducing the risk of SUDEP. Paddy, can I ask you a question now? Can I ask you what Epilepsy Ireland is doing to raise awareness of SUDEP, and what changes you'd like to see in the health system on foot of this research?
So to answer your first part of your question, Yvonne, in terms of raising awareness of SUDEP, we lead SUDEP Action Day in Ireland, which is an international initiative to raise awareness of sudden unexpected death in epilepsy. Now, year on year, what we've been doing to, I suppose, increase our reach of that is appealing to families who have unfortunately lost loved ones due to SUDEP. Really devastating and harrowing stories is the only way I can describe them, but they're so important in terms of actually showing the realities of SUDEP, the real faces behind the figures that you have identified. And I suppose the questions and the unanswered questions that they have following the loss of a loved one. It also allows us to remember those people who have been lost, but crucially what it does is it encourages people to learn more about SUDEP and the known risks. Unfortunately, what we find through these stories is that the first time families hear about SUDEP is whenever it's in a coroner's report or in a death cert, and it's obviously much too late. So these families have been incredibly brave in terms of sharing their stories to help encourage others to learn more and memories of their loved ones. So that's what we've been doing in terms of awareness. Obviously, in the general sense, SUDEP forms part of all our education engagements with people who might be diagnosed or people approaching our service for the first time through our epilepsy toolkit, our information sessions, and so on and so forth. And we would regularly, using the channels available to us, such as our social media channels, month on month, we will have a post up about SUDEP, because obviously there's new people following us each time who might be newly diagnosed, newly on their journey with epilepsy. So we're acting as a platform to continually share the importance of that message of SUDEP and knowing the risks.
Paddy, on foot of this research, what changes would Epilepsy Ireland like to see in the health system?
So on the back of your research, Yvonne, what we are calling for and advocating for is a national strategy to reduce epilepsy-related deaths and SUDEP. Now, not only is there evidence from your findings for this, which is given the incidence of SUDEP, but there's also, I suppose, international obligations for us as well to do this, that calls for strategies to reduce preventable deaths. That is something Ireland has agreed to, and we've signed up for, and now we should very much action this, not only based on your research, but based on research we're getting back from attitudes to communications around SUDEP from patients. So just one figure in particular I'd like to refer to is that 47% of people with epilepsy who responded to a survey about SUDEP communications said they changed their behaviour as a result of being counselled on SUDEP. Now that can be things around lifestyle, adherence to medication, all the risk factors that are known about SUDEP. So that shows really why it's so important to take targeted action on this. And I suppose hooking into the health services as a whole, how do you reduce the risk of SUDEP? You get people seizure free. How do you get people seizure free? You improve their access to epilepsy infrastructure and services. That means timely access to consultant neurologists, epileptologists, quicker diagnoses, quicker access to, surveillance treatment is the way I would term it, like EEGs, etc., EMU, and innovations like surgery. All of those, in theory, should reduce a person's risk of SUDEP by increasing their chances of becoming seizure free. So there's a whole conversation that needs to be had around this. And I suppose as part of a national strategy, what we envisage, we do not, and we will never present ourselves like this, Epilepsy Ireland do not have all the answers to how to address this problem. But we are confident that if we, for example, set up a stakeholder group on reducing epilepsy-related deaths as part of a national strategy, we are confident that with representatives from the HSE, Department of Health, bereaved families, and so on and so forth, representatives from the community such as GP, we're confident that we can potentially reduce those numbers. And that's exactly what we should be working to do now that we have these numbers. We know the scale of the problem. Now what are we going to do to address it? Yvonne, what's the key message you would like to share with the epilepsy community and I suppose the public as well about SUDEP?
Paddy, I'm very cognizant of the fact that I don't want to scare the living daylights out of anyone. I mean, we know that SUDEP happens. It's a recognised phenomenon. It is a rare event overall, but knowledge is power. I don't think we can shy away from this, particularly if there are actions that we can take that might reduce the risk for an individual with epilepsy of SUDEP.
Yvonne, I'd like to thank you for joining us here in Epilepsy Ireland HQ to share your insights, expertise. Obviously, a huge congratulations on the publication of the study. We're obviously looking forward to the data from the next part of the study as well. I think we're in agreement that we hope it will lead to all the changes that we need to see happen. I hope everyone watching is in agreement as well. I would just like to close by saying, if you are living with epilepsy, someone you love is living with epilepsy, please do take a moment to visit our website, www.epilepsy.ie, and visit the SUDEP section of the site to learn about the known risks. And learn more about our overall campaign to reduce epilepsy-related deaths in Ireland. Working together with clinicians like Yvonne, the medical community, through awareness, through research and through action, we can potentially reduce epilepsy-related deaths in Ireland. Thank you for watching.